Premature ejaculation should occur as an early ejaculation which does not satisfy one or both the partners. It should occur for 75% to 100% times in a period of say 6 months. It occurs usually within 1 minute that the patient ejaculates, and this is insufficient for partner. Anxiety in any form can give rise to premature ejaculation. Mr. Singh was very happy this morning. He was going to meet his ex-girlfriend who had come all the way from Australia, and the plan was that she would stop for 4 hours in Delhi before catching a train into Amritsar. So here was Mr. Singh in the car going to the airport to pick his ex-girlfriend up and take her to his residence. He was even humming to himself, and soon his ex-girlfriend and himself, they were in the car on the way back home. But no sooner was in the car and they started fondling a bit, and plus the excitement in Mr. Singh's mind, he ejaculated in the car itself. And the entire planning went awry. So what did they do? They ended up going to Mr. Singh's residence, having a cup of coffee, and he dropped her to the New Delhi railway station for her onward journey to Amritsar. Another situation, Ajay was a young adolescent boy. He used to masturbate daily in the bathroom. But since there was only one bathroom in the house, the other family members would start requesting him to come out after a period of time. So much was the pressure on his mind that even while masturbating, he would finish off quickly so that he could get out of the bathroom soon. Slowly but surely, this became a habit in his case, and he started suffering from what is known as premature ejaculation. Premature ejaculation is all about satisfying both the partners. If after ejaculation, one or both the partners are dissatisfied with the performance, then this is known as premature ejaculation. There is no time attached to it, so that if both the partners are satisfied, even with 30 seconds or 1 minute, then so be it. This is not premature ejaculation. But however, if one of the partners is dissatisfied, then it becomes premature ejaculation. A lot of people have put a time limit to it, saying that if after penetration the man is able to prolong his discharge for more than 1 minute, he has not got premature ejaculation. But if he discharges in less than one minute, then that is known as premature ejaculation. There are so many definitions for this condition, which itself says a lot about the condition, that we know very little about it. There are two types of premature ejaculation. One is primary premature ejaculation, and the second one is secondary premature ejaculation. The primary premature ejaculation occurs from birth or immediately or a little after birth, and the secondary occurs due to influence of many situations that one comes across. Like in the case of masturbation of Ajay, this was situational. This is a common complaint in the youngsters of today, especially in the Indian subcontinent. In fact, it is more common than erectile dysfunction or impotence. Why it should occur so commonly, we do not know. But it has got a lot to do with the mind. Unlike erectile dysfunction, which has more of a physical basis. Basically, premature ejaculation should occur as an early ejaculation which does not satisfy one or both the partners. It should occur for 75% to 100% times in a period of say 6 months, and only then is it labeled as premature ejaculation. This gives a lot of stress to the partners. The male partner feels ashamed of his performance and may gradually stop having sexual intercourse. It results in sexual frustration, dissatisfaction, and discord in the family, and may result in divorces. It is equally difficult to treat since we don't know the exact cause. You have to rely on what works for a particular person. In fact, both psychological as well as the somatic or the physical defects work in tandem, work together, and this results in premature ejaculation. The main problem with premature ejaculation, as I mentioned earlier, is that it occurs usually within 1 minute. The patient ejaculates, and this is insufficient for partner. The other causes of premature ejaculation are early sexual experiences of the person in life, in childhood. He may have had sexual abuse, and this results in premature ejaculation later. Depression is another one, and worrying about the premature ejaculation itself gives rise to further premature ejaculation. Also, erectile dysfunction in a person can give rise to this condition. Anxiety in any form can give rise to premature ejaculation, and relationship problems occur either due to it or maybe the cause of premature ejaculation. There are physical defects also that can cause premature ejaculation, and prominent amongst that is infection of the semen. In the Indian subcontinent, prostatitis is very common, that is inflammation of the prostate gland, where it's not necessarily due to infection but due to other factors. That is also a very important factor, and that inevitably gives rise to early discharge or premature ejaculation. Then certain hormones are involved in the ejaculatory process. They get deranged. Prominent amongst them is serotonin, which is released at the nerve endings to allow it to be transmitted to the distal nerve, to the nerve which is going down into the penis. You see, there is not one nerve that goes down from the brain to the penis. It is a small nerves which are interconnected by hormones. And therefore, this hormone, if they're not in the proper amount, gives rise to premature ejaculation. And this hormone is known as serotonin, which is used in treatment of this condition also. I'll tell about that later. These days, stress is becoming a very important factor, and stress of any kind can give rise to any sexual problem, particularly erectile dysfunction and premature ejaculation, or both of them. The other physical defects that can cause premature ejaculation are hypersensitive glans penis, a tight foreskin, and comorbidities like diabetes. All these can cause premature ejaculation. There is also a talk of genetic predisposition of this condition. By that I mean that it is transferred from father to son in the family. So what can one do about it? The treatment largely lies in lifestyle modification. That is one of the prominent things that needs to be done, and currently with all the stresses and strains the doctors have to face, they do not seem to have the time to spend with the patient to explain to him what all he should change in his lifestyle to improve this condition. I have tried to enumerate them in my earlier videos, one of the earliest videos, and you can have a look at them as and when you have time. The 10 commandments are very useful, especially for this condition, because mind is by nature depressive, and it produces all negative thoughts in the mind, including premature ejaculation. How to control the mind, how to get it stronger, this is done by some good yoga techniques and certainly by meditation. Exercises can be done, which are always useful, but I would suggest that you go through the videos that I have done earlier, and in that you'll find a more detailed account of the lifestyle changes, modification. Alcohol should not be taken, smoking should not be done if one has this condition, or even to prevent this condition. Then there are certain things that one can do at the time of sexual performance to delay the inevitable or to delay the ejaculation. This technique was first described by Masters and Johnson and is known as the squeeze technique. At the time when the man feels like he's going to ejaculate, just before that, he takes his penis out, and either he or his partner presses the tip of the penis with thumb and index finger and does the reverse counting from 10 to 1. This takes his mind away from the ejaculatory process and the person is able to carry on and start again. However, this is very cumbersome, and a simplified version for that is stop and start technique, in which the man, as soon as he nears his inevitable ejaculatory point, he stops the activity and signals the partner also to stop the activity. Takes his mind away from the present situation until he is again able to control his ejaculation completely, then they can start again. However, as you can imagine, they are not very satisfactory techniques, but in the absence of more specific answers, they are good enough. Exercises, particularly Kegel's exercises, are also good. Even if they are performed during the act, they are good. Counseling definitely helps, and you have to see a sexual counselor. It's a slow process. There's one technique called the sensate focus technique, which requires a lot of patience between the therapeutic person and the couple. In these days where everything is rush, not many people would opt for that. Then there's medical management. There are certain drugs which are available. Such is the pace of life that neither the doctor nor the patient has time to deal with the lifestyle modification first. But medical treatment is to be taken along with lifestyle management. Alone, the chances of success are only 50%. But when it's combined with lifestyle modification, then the two become 75%. In our day-to-day life, there are doctors who treat premature ejaculation, just give drugs and hope that this will cure the condition. What are these medicines? These are known as SSRI. Or remember the hormone that I was telling you about, serotonin? This is where these medicines act, and they prevent the serotonin from being taken back into the nerve cell and being destroyed early. So these are medicines which prolong the action of serotonin, and as long as the serotonin is there at the nerve endings, the man can keep on performing. These medicines can delay the ejaculation to some extent, and as I've said earlier, lifestyle modification along with this drug medicines is very helpful. And finally, there are local sprays that are available to be given to the head of the penis, the red portion where there's maximum sensitivity, and using xylocane, which is one of the local anesthetic gel that can be applied to the tip of the penis. One has to wait for about half an hour after application for the medicine to be absorbed and cause its action. The same thing is available as sprays. Now there are a lot of sprays available in the market, but only very few of them work. I have patients who have come to me having used the spray and then also got erectile dysfunction, which they did not have initially. Now they've added another problem themselves. So one has to be cautious of taking these sprays, and I would suggest that you consult an andrologist before you start taking any medication for treatment of premature ejaculation. This condition is difficult to treat, but treatment is possible, provided you follow the guidelines that I have described in this video. If you like this video, please press the icon button for like. You may send me any comments, suggestions, or anything that you would like me to talk about in the comments section. And oh yes, don't forget to subscribe to my channel by pressing the subscribe button. Thank you very much for your patient hearing.